So we're here today to hear from Dr. Amy Comander and Karen Wanders about physical activity in cancer survivorship. My name is Mariana. I'm the CEO and co-founder of the After Cancer. And before we get started with the webinar, I just wanted to give a little bit of context on why we run these sessions and why we're here today. So, the After Cancer is a digital platform for cancer survivors. And so, we're very keen on raising awareness about what is survivorship and what are the main topics that encompass survivorship. And so, that's why we started to do these expert insight sessions. We talk about different topics every month, and so today we're focusing on physical activity, and I think it's the first time I actually talk about this topic, so I'm excited um, to do this. And then just walking you through a few slides here. So as I mentioned you, at the After Cancer, we really make comprehensive survivorship programs possible, but also cost effective. We've developed evidence-based resources to meet the three main needs of cancer survivorship. So we cover side effect management, risk-reducing lifestyle approaches, and psychosocial needs. And physical activity is one of them. So we do this on a virtual platform. So we work as a virtual extension of your cancer program, allowing you to scale support after treatment. And patients have access to this app where they get a care plan, they get educational materials, they can attend group sessions, and they also have support via chat. And the cool thing about what we do, and this is why I'm really passionate about it, is that we not only improve outcomes of patients, but we also help lower the cost of care. So when we work with organizations, we help them meet accreditation requirements like the Commission on Cancer. We help reduce survivorship costs and really deliver care without having to hire a whole team of survivorship experts. From a patient point of view, we see an overall improvement on quality of life, which is why we're all here today. So that's it about the After Cancer. I'm going to stop sharing my screen and let's get started to hear about our speakers today. So I am going to ask you to introduce yourselves. Dr. Amy, could you start, please?
Hi, thank you so much for inviting us, by the way, to join you. And it's really such an honor. And it's also been so wonderful to learn about what your organization, what you do to support patients after they've completed primary treatment. It's really inspiring and so needed. So thank you, thank you, thank you. And I'm so honored to do this along with Karen Wonders, who I deeply admire, and she knows that, I hope. So I'm a breast oncologist here right outside Boston. I am the medical director at the Mass General Brigham Cancer Institute in Waltham, which is where I am right now. In addition to my work caring for patients with breast cancer of all stages, I also direct the lifestyle medicine program at the Mass General Brigham Cancer Institute. So talking about exercise, prescribing exercise, and other lifestyle interventions is part of what I do every single day. And so great to see the interest in this from everyone who's here so we can all work together to make sure all of our patients are aware that exercise is medicine. So thank you so much for the invitation.
Karen, over to you.
All right. Well, thank you. Thanks so much for inviting me and allowing me to be a part of this. I am a big fan of Dr. Amy's, so this is our first time presenting together in a webinar. So very happy to be here and talk with you all. I have a PhD in exercise physiology and have been conducting research and studying in the field of exercise oncology since 2003 and have really seen a huge shift in not only the momentum in this field, but just the awareness, the conversations around exercise, not only with physicians, but with patients, with caregivers. I really do believe that we are on the brink of a major, major movement. No pun intended, movement, a movement. But, just very excited to be here. And I am the founder and CEO of an organization called Maple Tree Cancer Alliance, and we partner with hospitals across the country and in 25, I believe, other countries around the world, delivering individualized exercise services for patients from the time of diagnosis all the way through the trajectory of survivorship and beyond. And we also have a certification program where we can certify people so that they can work in the field and help cancer patients to feel good and to, thrive as they're going through cancer treatment. In addition to that, I also work as a professor at Wright State University. I'm the program director over an exercise science undergrad program, and just recently, last year, started an exercise oncology certificate program, which I think is a testament to the momentum that we're seeing in this field and the need to build a workforce and credential more providers. So, very happy to be here.
Thank you. Just as a context of like why we're here today and like why we have Dr. Amy and Karen talking. When I had the idea of doing the session about physical activity, I posted on this community called CSPN asking, I'm looking for an oncologist who want to talk about physical activity and exercise and survivorship. And Dr. Amy, I had so many comments mentioning your name. And then when we met, you mentioned Karen, and I already knew Karen and her organization, so it was just like the perfect scenario of why we have the two of you speaking here today. So, Dr. Amy, you mentioned something interesting and that I love, which is exercise is medicine. Um, I've I would say like in the last year, we've heard several times from several clinicians that like physical activity can be a very like underused treatment in survivorship. It's not used enough. Can you talk about exercise is medicine and why is it still so underutilized?
A great way to start this off. And I will say, and I'm sure many of the oncologists on here would probably agree with me, when we go through our many years of medical training to get to where we are, unfortunately, the concept of writing an exercise prescription or even really asking your patients detailed questions about exercise and recommending it, it's not really emphasized in training, even in my internal medicine residency, which was, mostly inpatient caring for sick patients in the hospital. So I think when we're thinking about exercise, weight management, nutrition, like so many of these topics that are all related, we just weren't really trained as much to ask about these things and to have specific evidence-based recommendations. So that's why there maybe isn't as much comfort level, and we need so many people on here, including wonderful Karen, to like help us be comfortable. Like, what can we actually recommend? But the reason why I do think, and we can talk about this at length, like we all do need to be talking about it for so many reasons, but just look at the challenge trial that was like presented at ASCO last year, American Society of Clinical Oncology, and published in the New England Journal of Medicine, which many consider, the Bible of medical journals, a phase 3 randomized trial in patients with stage 2 and 3 colon cancer demonstrating that a structured exercise program improves disease-free survival and overall survival. So this is a huge study, and I'm sure we'll talk more about it, but I think we do need to be talking about exercise. And certainly I talk about this with all of my patients with breast cancer, and I'm hoping my other oncology colleagues are getting increasingly more comfortable asking about exercise and talking about the recommendations with their patients. But it is an area for further learning and education, I think, for our field.
Karen, a lot of the work that you do is the educating piece. Do you want to share your point of view?
Yeah, no. And I think in my experience, so the way that Maple Tree works is we partner with different hospitals and we work as a subcontractor. And so patients are referred to us as they're going through cancer treatment. And a lot of times physicians will refer to us, nurses will refer to us, social workers. And in my experience, I really have not come across largely physicians that just don't value exercise or don't understand the role. I think maybe initially when I first started my organization 15 years ago, I dealt with that. But nowadays, and I really believe thanks to the challenge trial and thanks to the 33,000 other published peer-reviewed articles that we have on this topic supporting the role of exercise, I don't really get that impression that clinicians don't value exercise. I think Dr. Amy is correct that sometimes physicians don't know what the recommendations are, so they don't know what to say. And I think ACSM has a really good way of, teaching just a very simple assess, advise, refer. So ask your patients, are they exercising? And, see how much exercise they're getting compared to the recommendations, 150 minutes per week, and then have a place where you refer them to. And that could be where a barrier is not necessarily knowing where is a reputable exercise program that I can refer patients into, where I know that they're going to be, you know, treated well, treated safely, and have effective exercise programs. So I think that is really important. And also, I think sometimes it's just the lack of time. You as physicians and nurses and in your roles, you have so many things that you're dealing with and so many questions that you're answering. And sometimes I can see where this might kind of fall to the wayside in light of all of the other things. And so we always try to support as much as we possibly can and make referrals as simple as possible. And so that, you don't have to spend a lot of time doing this. This can be something where, you have a trusted place that you can talk about the importance of exercise and then let someone else do the heavy lifting beyond that.
And Karen, you mentioned about the recommendations, and I think probably most of us know what they are. Could you just quickly recap what are the like basic recommendations for physical activity?
Yes, no, happy to. So in 2019, the American College of Sports Medicine published 3 roundtable papers that was based on all of the existing evidence at the time, and they outlined the primary benefits of exercise in a cancer population, and then they also outlined exercise-specific recommendations. And what you'll find, and I hope that this makes it easy for everyone on this call, the recommendations for a cancer population are almost identical to the recommendations for a healthy population. So what we're looking for is 150 minutes of physical activity of aerobic exercise each week. That can be broken up to 30 minutes a day, 5 days a week, and then also including resistance training 2 to 3 days per week, flexibility training. We also include balance and range of motion and postural exercises, just because oftentimes those factors are going to be limited in this population. So that's where you start from. And then beyond that, what I really recommend is the individualization of the exercise program. Because for some people, they were active before their cancer diagnosis, and they absolutely can continue to do the 5 days a week, 30 minutes a day, no problem. But then, and I know for me, about 80% of the patients I work with have never exercised before. And so I tell them 150 minutes of exercise every week, and that just seems so daunting. And they think, oh, I'm so tired. Oh, I am sick. Oh, this and that. And all of those things start to become these huge barriers that's hard to work around. And so meeting someone where they are and helping them to progress to those guidelines, I think is really important. I always say something is better than nothing. So if all you can do is 5 minutes, we're going to start there, knowing the recommendations are up here. We'll get you there, but let's do what you can right now.
And Dr. Amy, how do you position these recommendations when you talk about physical activity with your patients?
Right. So, I should also mention, thank you, Karen, for reviewing that so beautifully. ASCO, American Society of Clinical Oncology, our meetings in a few weeks. It's in the guidelines now that oncology providers should counsel patients undergoing treatment for curative intent about the benefits of physical activity. So it's in our guidelines. It's black and white. I think it's still a work in progress, so we actually do that. But when I talk to a patient and share like the guidelines that Karen just outlined, it's true. Sometimes a person is kind of deer in the headlights, like 150 minutes. And so you just kind of have to say, okay, that's moderate aerobic activity. It could mean a brisk walk, with your neighbor. Maybe you're walking your dog, maybe. But we certainly, as she beautifully noted, we have to meet the person where they are. Some people don't do anything, or I shouldn't say it like that. They really can't. They've been going through so much. It's really hard, and getting started is just so challenging. And so, that's why I often try to help patients think of strategies, just how to get started, maybe 10 minutes a day of walking around your driveway or walking even in your house. There's just so many ways we try to talk to our patients about how they can get started. I do think thinking about strategies to help people get started is so key. And just one example that has worked really well With my patients, I run a survivorship program called Paving the Path to Wellness, where we teach breast cancer survivors about tools from lifestyle medicine. And when we talk about physical activity, we really emphasize the concept of having an accountability buddy. Like maybe there's someone you text, like, okay, I'm going to get in my 10-minute walk today. I'll text you when it's done. And just having that accountability piece really helps so much. So that's one strategy that I've seen with my patients that can be very helpful. And I'm sure we can learn from each other about more.
Thank you. And then, so we talked about recommendations and what is physical activity. I would love to talk a little bit about the benefits. And most of us have heard of them and we can guess, but from a research standpoint, Dr. Amy, could you walk us through the benefits of physical activity?
Making sure I was off mute. Okay. So, well, we know from so many studies, certainly the challenge trial, but as Karen noted, many other studies that have been published over the years that, for individuals with cancer, there are so many benefits from physical activity in terms of addressing cancer-related fatigue, which is the most common problem our patients complain about in clinic, helping with mood in terms of addressing anxiety and depression, helping with sleep. Sleep disturbance is so prevalent among cancer survivors, and we know that physical activity can improve sleep. Addressing body composition, that's certainly a major issue my patients with breast cancer are dealing with through the various therapies that they're on. So, of course, exercise can help with that. And then, in addition, the breast cancer population often is worried about lymphedema and risk for that. And we know exercise is beneficial. So, those are just many examples of why exercise is so beneficial. And we're learning more and more through so much great work being done by many of you on here, the whole science of exercise oncology. Karen, I love the work that you do and just trying to understand, like, at the molecular level, what's happening in the body when a person exercises that can help provide so many of these benefits for our cancer patients. And that's just such an interesting area as well.
Erin, I don't know if you want to add anything.
Yes, well, I'm a huge advocate for exercise. And, you look at exercise, and I really think it's one of those few interventions that can improve multiple outcomes all at the same time. And so it's almost like, what doesn't exercise help with? It's generally very safe when it's appropriately prescribed. And, not only can it help with the physical, but Dr. Amy, I think, also touched on the psychological things that patients are going through. And, I think it's important not to discount that, because I do believe that exercise really does help give someone a sense of agency, particularly in a time when things probably feel like they're spinning out of control. A lot of people that we work with never saw their cancer diagnosis coming, and they're so scared and they're so overwhelmed. And, I think when we live in this cancer world, we know what their next steps are. We know what they're going to walk through, but they have no idea. They've never walked this road before. And when things are feeling like everything is spinning out of control, you really try to cling to those things that you can control. And you can control this even on a day when you don't feel good, when you don't have the energy to go to work, or you're worried that you're going to miss out on family activities. Even in those days, even a simple walk around your house. Dr. Amy, I love that you said that. The reason I started Maple Tree was because my grandfather had colon cancer, and it was very aggressive. He passed away 5 weeks after his diagnosis. But even for him, a simple walk around the downstairs of his house made a huge impact. He still passed away from his cancer, but before he decided to walk, even if it was just around the downstairs of his house, he had stopped eating. He, was slipping in and out of just sleep states all the time. And this really kind of gave him his final days, his final weeks with his family, allowed him to stay in his home, allowed him to say goodbye to his family. And, and it was almost like a light, would, oh, it's time to do my exercise. Like, oh, okay, let's do that. Even what I can do. And that really was impactful for me because I come out of the world of exercise on call, exercise physiology where it's like no pain, no gain, and you got to be sore the next day. But that doesn't necessarily apply here. And even little bouts of exercise, doing what you can do, just little simple movements really can have a huge impact in the life of a survivor. So yeah, I think the benefits just are so numerous. They could go on forever.
Thank you for sharing your personal story, Karen. Dr. Amy, do you have a story from one of your patients, someone with whom you worked that you recommended physical activity and that you saw kind of like the progression and improvements?
I have so many stories, but one just comes to mind right now that I just love this story, so I'm going to share it. So I think I mentioned I run this program called Paving the Path to Wellness, which is a lifestyle medicine-based survivorship program for women with breast cancer. And so, of course, we talk about physical activity, and one of the members of our group many years ago had been a spin instructor, but she kind of took a hiatus from that, especially as she was going through her aggressive cancer treatment, chemotherapy, surgery, radiation, the whole shebang. Okay. So after she was finishing treatment and during paving, she discovered the Live Strong program at our local YMCA. And so she's like, I encouraged her to go do that. And another woman in our paving group who was in her 70s, it was like, I'll do it with you. So these two women, one in her 40s, one in her 70s, they did the Live Strong program together. They bonded, by the way. It was really, really special. Now they're really good friends. And then the younger woman decided, wow, I would love to get back into teaching spin classes and maybe teach the Live Strong program. So she went through the training herself. And now she's like one of the lead instructors at the Live Strong program at the local YMCA. And other participants in our program have now done Live Strong with her. And now another participant is going through the training to teach the Live Strong program. So I just like love that story. That's just one of many I could share, but it really just shows how these women inspire each other, their love for physical fitness, their love for the social connection. And so I just love talking about them. And they wouldn't mind sharing their if I shared their names, but they're just doing great. And so I still tell people, go ask for Katie at the YMCA and she'll tell you her whole story. So I'm sure, Karen, you probably have a million stories too.
Oh, I love that. And you were talking at the beginning about having an accountability buddy. And so that's
Yeah.
exactly what those two women did.
Oh, yeah. I mean, one in her 40s, one in her 70s, they never would have bonded, but they bonded through
Yeah.
Live Strong. And seriously, they sometimes send me a picture where they meet up for lunch together. So I love that.
Oh, that's so cute. And for those who are not familiar with Livestrong, could you share just a little bit about what it is, please?
Sure. And so I think at many YMCAs, it's a program that it's a, free exercise program for cancer survivors. And I think it's a 12-week program. Karen, you can correct me if I'm wrong about that. But so when they do the program, they do get a Y membership during that time frame, and it's really geared for all levels. And I think it was funded by Lance Armstrong's foundation. I think it still is. Anyway, so many the YMCA's around here where I am outside Boston happen to have the program and it's very accessible. So many of our patients do participate, but we do have to encourage them because, not everybody knows about it. So a number of my patients have done it and really derived great benefit.
Thank you for sharing. Well, we have a few comments about folks who have experienced Believe Strong and have really good experiences. So happy that you shared this resource. Um, let's talk about how can clinicians and how can folks attending this call start recommending physical activity with their patients? Um, Do you have any tips on how they can talk about physical activity? Either they have or not resources within their center in their hospital, but how should they position it with patients on why patients should start exercising? Karen, I know you have a lot of experience in this field with your training programs. So could you share your point of view and experience, please?
Yeah, sure. I think, the best advice that I can offer would be try not to make it vague because I think a lot of patients know that they're supposed to be exercising, but they might not know really what that looks like. And as Dr. Amy said, sometimes there's a lot of fear around exercise. I once had a patient tell me she was more afraid to come to Mapletree than she was to take her chemotherapy. And knowing that sometimes that is the mindset. So I think addressing that fear and really making exercise a part of that routine conversation, so that at diagnosis, during their treatment, at survivorship, they're being talked to about exercise, and almost making it so that this is as expected as part of your treatment as chemotherapy, as radiation. And in fact, it's something that's going to help you feel better as you're going through the treatment journey into survivorship, dealing with the long-term and late effects of treatment. And I really think that the ACSM initiative, the assess, advise, and refer, that structure is probably the best method to use. So assessing if your patients are active or not, advising them, knowing what the guidelines are. Hey, you're not exercising. Well, this is something that can help. And knowing what the guidelines are, knowing some key bullet points that you can kind of take out of your pocket and share with them, particularly if they're experiencing like fatigue or peripheral neuropathy, balance issues, different things like that, having kind of checkpoints along the way. And when you hear things like I'm dealing with severe fatigue or, whatever, then kind of having that trigger that conversation. Oh, well, just sometimes simple movement can be something that can help boost your energy levels and help you combat fatigue. So kind of looking for those opportunities to insert exercise into the conversation, I think is really important, because I think the more they hear about it, they meaning the patients, the more likely they are to engage in exercise. And that's really what we want. I mean, I think the latest stat that I saw is still less than 20% of patients are meeting the exercise guidelines. And so how do we increase that, not only by having programs and making the programs available, but really by nailing this down, that this is a part of your treatment. This is an expected part of your treatment, and it will help you as you go through the cancer journey.
And Karen, within the hospitals that you've partnered with, what have you seen are the main barriers for them to create and set up their exercise program
Barriers for the hospital or barriers for the patient?
for the hospital?
Ah, okay. So, because they're different. So usually funding, and I saw that there was a question here regarding some funding. So this is not a service that is covered by insurance yet, although I do believe by the end of this decade it will be. So that is going to be a huge, huge step in the right direction. But typically what we do whenever we work with a hospital is we got to figure out the funding. Often, because with Mapletree anyway, it's free for the patients. And so usually we have to go to a hospital foundation, or we have to work within the overhead of the budget to show that, yes, you'll pay for the exercise program, but here's the ROI that comes back to the hospital in terms of lower healthcare utilization, that sort of thing. And usually there'll be parameters around number of patients we can serve, how many times we can work with them. We try to get up to 12 weeks, 12 visits, once a week for 12 weeks. Sometimes we're able to get there, sometimes not. Just it depends on the hospital setting. And then pre-COVID, a lot of times we dealt with space and where can we deliver the exercise program. You can see my background. This is one of our hospital partnerships in Kettering Hospital in Dayton, Ohio. So this is our one of our nicest facilities that we have. And other times, if we're in person, sometimes we're in a conference room. Once we were in a stairwell, but that worked because we can just do stairs. We can do step up. There's all kinds of things you can do in stairwells. But with COVID, that really has opened up this whole new world for us, in that we can now deliver exercise virtually via telehealth. And I would say now about 2/3 of our partnerships are delivered via telehealth, which makes it very nice for the patients. They can stay in their home and exercise in their home where they're comfortable. We can work around if they have equipment or not. And you don't have the space constraints that you sometimes see within hospital settings. So I would say those were the two main barriers. And then beyond that, it's getting the entire clinical team on board with this. We want everyone to know that we're here, that we exist to serve and to help their patients, and that we're hoping that we can improve their outcomes as they go through treatment, and really trying to build those physician champions and people who are going to support the program. Sometimes that happens very naturally. Other times, we do have to work at it. And, it's just something that we have figured out through the years. But those are usually the biggest barriers that we have in a hospital system.
Thank you. Dr. Amy, following up on this barriers discussion, you work in a setting that has a lot of resources. You've built your lifestyle program for cancer survivors. How would you recommend folks in this call who maybe work at a community hospital or in a rural area where they don't have that comprehensive program? Where can they get started?
Well, I will say I shouldn't say my team and I started this program right before COVID. We just kind of started it. We actually didn't have a lot of resources. So I think we were all just like really interested in lifestyle medicine and bringing it into oncology care, specifically focusing initially on the patients with breast cancer. But of course, we know all patients would benefit. And so we raised some money to get started and just kind of found a conference room and started doing this educational program. And it's obviously grown a lot since that time. So I would say, though, if you are in a smaller hospital without a ton of resources, first of all, just see what's in your community. Like we talked about Livestrong earlier. Do you have a YMCA that maybe has that program? Or maybe there's other gyms that may have specific programs that they'd like to collaborate with you to develop something specifically for cancer patients, or maybe in the hospital, there's some kind of resource. And then finding your team. Like for me, I feel so fortunate because I have this great multidisciplinary team. We have a nutritionist who's so passionate about this work. We have physical therapists. We have a physiatrist, which I'm so lucky, I know, to have a physiatrist trained in cancer rehab, other doctors, nurse practitioner colleagues, nurses. So I think finding a team of colleagues who are like all in, who want to kind of collaborate together to figure out how to provide exercise offerings or other areas of lifestyle medicine to cancer patients is just the place to start. And then you'll kind of build it from there. So there's also so many great resources online, like talking about Karen's programs and like other programs. So there's just lots of things out there now that we can figure out, put our heads together to offer to our patients.
Thank you. And then let's talk about barriers for patients, which is the other side of the coin. Dr. Amy, what have you seen and how do you deal with those barriers?
Yeah, so I know certainly I can share what I see in my own clinic, but certainly there are many research studies analyzing this, and a recent study coming out of ASCO surveying patients about, first of all, is your healthcare team asking you about nutrition and exercise, and also what are the barriers for that? And I should say, in a publication a few years ago, less than half of the healthcare team ever asked about exercise, which is hopefully we're doing better now, but that was a few years ago. But for the individuals where someone just asked, like, do you exercise or what do you do? Like that made such an important impact on the patient to at least think about it. So just asking the question, even if there aren't a ton of things to offer, is a good place to start. But I would say a major barrier that was outlined in a recent study that came out of an ASCO survey was cancer-related fatigue, just feeling like there's just no way. My patients will tell me this sometimes when they're in the midst of difficult treatment. There's just no way I can do that. And it is really hard to hear. And of course, for each individual, as their doctor, I work with them to figure out, what can I do to maybe help them address that? Are they anemic? Do they have a thyroid problem? Is it a side effect of one of the drugs? We do the whole workup, but then I do try to explain that I know fatigue is so debilitating, but physical activity is one of the actual best interventions to help improve that. And that may be starting really, really small, as we've discussed earlier. But we do know that so many of our treatments also can cause decline in muscle mass, sarcopenia. And so finding ways to help individuals, even just start with a little bit. Again, we talked about walking around the house, walking around the living room, walking to the mailbox. Like the fatigue is a major barrier, but an important thing to get started to figure out how to address. And another barrier I can just say, like for somebody who's maybe like my breast cancer patients who are seen in follow-up, who are actually doing quite well, who I'm talking about exercise with them, they often just don't know where to start. Like, how do I get started? Because a lot of times we're talking about maybe they're doing their walking, but they want to start strength training, which is so important for so many reasons, and they just don't know where to start. So that's actually a common barrier too.
Karen.
I'm waiting for you to call on me, but if you want, I can just jump in.
No, just go ahead. Just go ahead.
Yeah, no, I think Dr. Amy touched on, a lot of those barriers that we see. I mean, I think probably the biggest barrier that we come across is just the patients have never exercised before. And now I'm going through cancer treatment. I have fatigue, I have pain, I have neuropathy, I have 100 doctor's appointments every week, and I'm supposed to exercise on top of that. Just the thought of that can oftentimes feel very overwhelming. And, beyond that, I think a lot of patients have a little bit of fear, not only about trying exercise, but about knowing what is safe. What can I do? I mean, Dr. Amy brought up resistance training. We see so many benefits to resistance training, but how do you teach someone in their 70s who's never lifted a weight before how to strength train? That can be a very intimidating thing for the patients. And so I do think it's really important to meet them where they are, do what they're able to do. Don't be afraid to challenge them. Don't be afraid to help, have them try something new, because you never know. I mean, there's a grandma that I see on social media who started weight training in her 70s, and now she's in her 90s. She's breaking all kinds of records. So you just never know when one of those is going to walk into your clinic. And then the other thing I would say is making referrals easy. And I always talk about making referrals easy on the physician side. I want one button that you press and it comes to us and we can take it from there. We don't want we don't want to make it any harder for you than what it has to be. But then on the patient side as well, if you're like, hey, here's a brochure, go look up their website, find their phone number, give them a call, schedule the appointment. Sometimes when there's a lot of steps to something, the inertia to get started, it's just too much for them, and they're just going to put it away and maybe deal with it later. So making it easy. And then I think expanding the delivery options. I talked about telehealth and how we have seen that has completely transformed our organization, not only in our dealings with hospitals, but then with patients as well, making it easy, making it accessible for them. Home-based programs. I mean, the challenge trial was a home-based exercise program. So I think that speaks to the benefits of home-based exercise programs. I still think supervision should be involved with that, but I think that there are ways that we can make a lot of different kind of delivery models available for patients, because it's not going to be a one size fits all approach. Some people are going to want to go to a fitness center, other people are going to want to stay in their home. Other people find that it's, comforting for them to go into the hospital where they're being treated. They know where to park, they know what stairs to take, they know where the elevator is. And that just kind of takes away a lot of the fear of the unknown for the patients.
Thank you for sharing. So I have two last questions before we get started with Q&A, and I can see a number of questions on the chat. Dr. Amy, pros and cons of one-to-one physical activity and group practice.
Ooh. Well, I think for people who are like just getting started, I'm just thinking of my patients and the ones who are kind of fearful of like, am I going to do something wrong? Am I going to exacerbate my lymphedema? Am I going to break a bone or whatever? There's so many fears that some people have when they're getting started. That one-to-one initially can be really great, but at the same time, the group support is so wonderful to help someone keep going and like live strong. One of the successful aspects that I've seen from my own patients is just they become friends with everybody in the group, so they look forward to seeing them at the YMCA. They become like a little bonded group. So but I think they both are really excellent. When I was working at a smaller hospital that was part of our Mass General system, we did have this amazing program where patients could have 3 free visits with a personal trainer in the hospital gym. How amazing was that? And so I think my patients did love having that one-on-one attention. But then I think a lot of times people do love the group support. But like I think it really also differs on the person, but they're both great.
Got it. And then what about online versus in person?
I mean, I know we'll get to the questions in the chat in a few minutes, but like about getting people to go to things in person. I think, as Karen has noted, since everyone's become so much more comfortable, look at all of us here on this Zoom. There are so many people now who love exercising at home. Maybe they get some, dumbbells in their basement and they have like a TV down there and they feel so comfortable working out at home and kind of fearful still of going into the gym, whether they're going to get sick or just the whole hassle of going to the gym or feeling uncomfortable in the gym. So interestingly, I saw 2 patients yesterday. It was so funny, one right after the next. They were both new to me. Both of them were women in their 60s. And I asked about exercise, of course, and they both have virtual personal trainers. And I was like,
Um,
oh, that's so interesting. Tell me more about that. So I think more and more people are getting very comfortable with doing that, but certainly going to the gym has its benefits as well. Again, I talk about that support if you're meeting up with people that help you stay motivated to keep going. So again, both great resources, I think.
Thank you. Karen, what about you? One-to-one or group practice?
Well, I am a big advocate for individualized exercise training when someone's going through treatment, just because I want to tailor it to not only their baseline abilities, what we measured whenever they first came into the program, but if they're having a bad day, if they didn't sleep well the night before, if they have, symptoms that they're dealing with. I have just found usually with the one-on-one, we have one trainer, one patient, they do develop a bond and a friendship and a trust with each other where the patients are more likely to share if they are having a bad day. They're more likely to show up if they're having a bad day because they know the exercise program can be tailored specifically to them. However, I'm a very social person. I love to exercise with friends, with my family. I, drag my kids to the gym with me all the time. And so I do think that there is a social component that can be very helpful to get people out the door and exercising and moving their body and closer to those recommendations. And so again, I guess I just go back to it's not a one size fits all. It's finding what's going to work for you and understanding that what works for one person may or may not work for someone else. And so I think having the different options available, the one-on-one, the Live Strong programs, the online virtual programming, I think having a variety of those things is going to be great because you're going to have some people that are going to do all of them. And then you're going to have other people that think, well, I'm most comfortable here in this situation. And that's what they're going to stick to. I have found with the individual, and I kind of touched on this earlier, whenever it's the one-on-one, I think one of the benefits to the individualized exercise training that I did not anticipate when I started my organization was the patients, the relationships that they develop with their trainers. And I think it's the one safe place that they have where, maybe with a spouse or with a child, even if it's an adult child, they sometimes can think, well, I don't want to share all the fears that I have, or I don't want to share as terrible as I am feeling with them because I don't want to scare them. I don't want to make them worry needlessly. I just want I just want life to be as normal as possible. But they do feel that they have that safe place where they can share really what they're feeling with the trainers, so much so that we have had our trainers go through empathy training and behavior change training and what to do when sometimes the issues are beyond your skill set, have a place you can refer them to, because we're not necessarily trained as psychologists, but it's almost like they become psychologists for these patients. And I think that that's really special that they do feel that safe place. And it is one place where once a week for 1 hour, you're the focus and we're here to help you as much as we possibly can. So I have seen that be very beneficial as well.
Thank you. And what about online versus in person? And you already mentioned online several times, but any pros and cons?
Yes. So in person is great because we can measure their blood pressure, we can measure their heart rate. We know what we're dealing with. We have the equipment, set up. You can kind of see some of it behind me. The window's a little bit small. Where if it's virtual, sometimes you have internet issues, sometimes they don't have a smartphone or internet at all. I mean, we work in some very remote areas in Alaska and in Kentucky where Wi-Fi is very, very spotty. And so, working around those can definitely be a barrier. But once you work around those barriers, if you look at our participation and our attendance and adherence rates to our exercise programs, we're at about 86% attendance rates with our in-person. We're at about 93% attendance rates with our virtual. And I think eliminating the barriers of transportation and having to go to another appointment does really seem to help with that whenever patients can just access that in their home. But that has been our experience anyway. It wasn't something I would have ever tried to do without COVID. When COVID hit, it was either we got to try this or I think we're going to go out of business and I don't know what else to do. And so luckily, my chief science officer, Katie Schmidt, said, "Oh, we got to collect data on this. Let's see the feasibility, the efficacy, the safety of moving to a virtual online program." And luckily we did that and found that it worked. It did work for us. So, both options are great though. I would say anything to get patients moving.
Wonderful. It's been great to hear your experiences in this topic. I would say we can now get some questions answered. I'll start with a few in the chat, but if anyone has an answer, just feel free to raise your hand and I'll call you out so you can speak. So we have here a question from Angie on the chat, and she shares that we have access to an oncology fitness program at our hospital's wellness center. We struggle with patient engagement. Any suggestions? Dr. Amy, I can see you.
Well, I'm happy to
Muted.
start with that, and that's awesome that you have that. I guess my first question would be, do the doctors, nurse practitioners, and nurses, does everyone know about this program? Because when I worked at this hospital, Newton Wellesley, which is a community hospital part of our system, and that I told you we had this strength in motion program where patients got three sessions with a trainer. It was like this hidden gem. Like I knew about it, so I would like refer my patients, but I don't know if everyone really knew about it. So I would just say make sure the word is out about this amazing offering. Maybe make some flyers. Maybe you've already done that, but stick them in the exam rooms if they'll let you do that. But just like get the word out. Maybe, I think sometimes, we see this in our system too. Like there's a program that's kind of been around and maybe there was a big push and then people kind of forget about it. So I think just reminding us, I can speak to about, we're so busy in clinic and sometimes even a great offering like that, we might just forget to mention it. So just reminding everyone to like share these great offerings with the patients is so key. But that's great.
Can I add, I would also invite them to come speak at a place where patients are going to be. So a sport group, or if you have some kind of cancer survivor day, or you always see those kind of pop up around, having someone from the exercise program come and speak. And then sometimes what I'll do is I will lead the people who've come to my presentation. I'm not going to do this today, but sometimes I'll lead them through some exercises because I think just showing them what exercise is sometimes, like, oh, raise your arms up overhead, do this, do some marching. I mean, letting them see what it is, what exercise is all about. Sometimes we'll take the fear away and they think, oh, okay, this is something I can do. I'm going to give that a try. Just giving them a little taste of it, I think might help.
Yeah.
Can I add one more thing? I love that, Karen. One more thing that Karen mentioned earlier, just thinking of doctors and nurse practitioners in a busy clinic. If you're using an electronic medical record, which most of us are using now, if there's a button they can click, refer to exercise program. That's all they need to do. Like that could also really help because if you're expecting someone to email at the end of the day, and sometimes it may fall through the cracks. So making it as easy as possible to refer a patient is also key.
Yeah. And you just answered three questions in one go. Because we had Laura from the New Mexico Department of Health also sharing that they provide support for patients to join exercise program, but they didn't have a lot of signups. And I guess it's as Dr. Amy and Karen shared, getting champions to refer, getting information out there as much as possible to get them. And then we had another question about putting it into Epic for referrals. And yes, that can be done. Go ahead, Karen.
I add one thing, uh, just really quick. It made me think of it looking at the New Mexico question. I would also say it's okay to start small. Our first year of Maple Tree, we had 17 patients the entire first year. And that was me sometimes walking up to strangers at Target and asking them, do you have cancer? Are you exercising? I have this organization, blah, 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 blah. And, so I think it's okay if it starts small. And what you do with the patients that you do have is you collect testimonials. You take, if they will allow you to take pictures, you take pictures, you share their outcomes with the healthcare team, with other people. And people can see, oh, that person went through, she had success, she felt better. Maybe I'm going to give it a try as well. And so even if you just have a handful of patients, you still can really promote those patients and the impact that you're having, and then use that to get more patients. And I've also, like, I speak at Rotary clubs, I speak at churches, I speak at, Girl Scout groups, any place that will allow me to come and speak about exercise, I will do it, just so it's something that they hear. And the more they hear it, the more they think about it, the more likely they are to actually engage in the program.
Love that.
Wonderful. Yeah. So we have here a question from Bry about what baseline assessments do you recommend for this specific population?
Do you want me to jump in?
Yeah,
Sure.
I think you
Okay.
mentioned it earlier.
So if they're in person, we look at all 5 components of fitness. So we'll do a treadmill test. I personally do the Rocky Mountain Cancer Rehab Institute treadmill test, which has been validated in a cancer population. It's 1 minute stages. It's very nice for the patients to do. I know a lot of people do the 6 minute walk test as well. We do skin fold testing or bioelectrical impedance, muscular strength. We do the hand grip dynamometer, muscular endurance. We do the sit to stand. We used to do partial curl up, but we just changed to the sit to stand because of we want to measure fall risk in this population. That seems to be a path towards potentially getting insurance reimbursement. So we want to make sure that we have that data. So we do 30-second sit to stand, modified sit and reach for flexibility. We also do, goniometer, upper body range of motion. Those are the main assessments we do. We do have to tailor it a little bit for virtual, especially if the patient doesn't have any exercise equipment in their home, but you can still do this, the sit to stand. You can do a modified version of the sit and reach. You can do a goniometer virtually, so that will work as well. The timed get up and go, we do that one, whether they're in person or not out of person, telehealth people. But yeah, those are generally, and then we have a balance and a postural assessment that we do on all of our patients, and circumference measurements as well.
Thank you. It sounds like a really complete assessment for those like first visits on a one-to-one basis. And again, everyone, if you want to raise your hands and just ask your questions, just go ahead. Otherwise, I'll just keep reading them from the chat. Okay.
Can I say one more thing real quick?
Yeah.
So we do those at baseline, and then we repeat them at 12 weeks. And then that gives us data then that we report back to the health system just to help increase their awareness about the program and their support of the exercise program. But exercise physiologists know this, but a lot of patients don't. If you take someone who's never exercised before and then they stick to an exercise program for 12 weeks, they're going to see improvements on a lot of those numbers. Even when they're in the middle of chemotherapy, even when they're in the middle of radiation, a lot of times we will see 18% improvements in cardiovascular endurance, like 20% improvements in muscular endurance. That is so motivating for a patient who's never exercised before, who probably hates to exercise, to see I got stronger during chemotherapy. I thought I was going to be terrible. I thought I was going to feel sick all day, every day. And so I think baseline assessments are important, but then repeating them as the patients go through the program for that motivation and to build that support for the program is really important.
Another question here in the chat, Harry is asking, can you recommend any simple home exercise equipment?
Karen, I'll let you take that.
Oh, okay. I was like, I feel like I'm talking too much.
No, you're
Um,
good.
I mean, you can get one of those resistance bands off of Amazon for less than $20. I mean, I would get resistance bands, I would get handheld weights to start. Those bars, those like padded bars that you can get them in like 12 pounds, 15 pounds, 18 pounds, those are great. But I would just keep it very, very simple, especially when they're first getting started. I mean, even in our facilities where we work with patients, I mean, we're lucky enough to have a cable machine at this facility, but for the most part, we keep it with handheld weights, kettlebells, resistance bands. That's pretty much what we stick to.
Wonderful. And Erin is asking a question here. Part of the question is how to encourage patients and keep them motivated throughout the journey of starting, but also making it a routine. Dr. Amy, how do you manage this with your patients?
I know that that's the big question, right? How to actually keep people engaged, the whole behavioral change component to this, which is really challenging. And I know there's a question in there and too about the role of coaching, health coaches. I mean, it really is important to, I think, as a doctor and my team who I work with, that we continue to ask our patients about exercise and encourage them to keep going. But really, how do we get that person? I mean, I love, Karen mentioned earlier, sometimes the patient may bond with the trainer, which is amazing. I love those stories. Or they find a community that they're part of. So that's going to get them to keep going back to that class or to walking together or to the gym or whatever it may be. So, but I think it's definitely I tell my patients, think of exercise again. Exercise is medicine. If we like, some of us, I think everyone here likes that mantra. This is like a lifelong journey that we need to stay on, right? So to keep it going to help optimize our health and well-being. So certainly, I think it just takes a lot of factors to help people stay motivated and keep going. But that is a great question because certainly major component is the behavior change piece.
Perfect. And Karen, last question for you. What are the outcomes that you see post program?
Oh, I was just answering that question. So our program is a little unique in that most of our clinical settings partnerships that we have, we just work with them while they're in the active phase of cancer treatment. So usually it's 12 visits. It doesn't always, sometimes it takes 16 weeks, just depends on the patient. However, we do have a couple of ongoing studies where we're going to track those patients for up to a year. We're mainly looking at fall risk and if they have fallen and that sort of thing. But beyond that, we refer them into the community and we have community-based partnerships inside of fitness centers like Livestrong. We partner with Livestrong, where patients can continue to exercise in survivorship and get that support. And, I mean, what I hope that we can help people do while they're in active treatment is lay that foundation for exercise, teaching them what exercise is, giving them that self-efficacy so they know how to exercise, empowering them so they believe they can exercise, and all of the support and all of the tools that they need to continue to exercise for the rest of their life. That's ultimately what we are trying to accomplish. And, I believe if we are able to do that and someone is able then to enroll into a community-based program when they're in survivorship and continue to exercise, I think they'll see those benefits for the rest of their life. Not only, there are some studies that look at cancer recurrence in people who are active and, reducing cancer recurrence, but other chronic diseases as well. 2/3 of our patients have at least one other chronic disease. And we know that exercise can positively influence a whole host of other chronic diseases. So I always tell people this is going to be one of the best decisions that you are making during your cancer treatment journey that will impact the rest of your life, the complete trajectory of the rest of your life.
Thank you. And just to finish here, I love the comment that Harry made, which is finding an exercise that you like. It's important to help you change that mindset and keep you exercising, and I love that. Okay, we're right on time. Thank you, everyone. Thank you so much, Dr. Amy and Karen. It was wonderful to have you here today.